The role of the nurse executive in information technology decision making. What is a nurse executive? A nurse executive holds the most senior administrative role in nursing organization. They lead the nursing team and make administrative decisions that support the organization's goal. Nurse executives at healthcare organizations in all sizes need to commit a lifelong learning, especially if they are to participate and actively lead health information technology decision making. To acquire and maintain current knowledge of health information technology. Nurse executives need to be constantly updating and advancing their hospital information technology knowledge to productively contribute and ultimately drive technology decisions. Nurse executive must be up to date at all times because technology decision making happens with regularity throughout the year every year. Nurse executive must have a deep well of health information technology expertise in order to understand the delicate interplay of nursing and outcome data inside the healthcare organization and beyond. This knowledge needs to go beyond baseline functionality level information of nursing and clinical information systems. Technology life cycle. Technology life cycle ensures continuous health information technology decision making as long as the nurse executive determine that overlaying this life cycle with an ever-present technology obsolescence that complicates technology-related decision making. To better understand the essence, nature, and far-reaching impact of technology-related decisions, consider the six-stage technology life cycle. The life cycle of every technology investment spans six distinct phases, from planning to procurement, to deployment to management, to support and disposition, only to cycle back to planning. However, there are various stops and starts. Some are internally caused and others are triggered externally. Overlaying this life cycle with an ever-present technology obsolescence complicates technology-related decision-making further. There are three types of obsolescence. First, technology providers' architecture, product, and integration plans. Second, third parties' priority shifts. Third, regulators' unexpected recalls. The impact of planned obsolescence cannot be overlooked when nurse executives make HIT-related decisions. Technology providers worldwide required engineers to design obsolescence into their system to ensure ongoing market demand, project market share, and preserve revenue streams. Technology providers with nurse executives on staff tend to exercise considerable influence over architecture, product, and integration efforts. However, those without such internal nursing advocates may find nursing issues significantly overshadowed by financial and business pressures public and privately held technology companies face. Shifts in regulatory or payer-related priorities can trigger a range of system change from code revision all the way up to system replacement. Complying with these environmental mandates can throw the technology life cycle into free fall, as legacy systems struggle to accommodate regulators or payer mandates that were nowhere on the horizon when these systems were built. The third type pertains to regulators changing the status of a medical device or technology, either narrowing the approved scope of use or even recalling the product after it has been introduced to the market and is generally available. For example, one hospital selected a DFA-approved monitoring device and conducted extensive staff training only to have the product recalled 3 months before its formal deployment. Obviously, the rollout of this delayed, but considerable time and money were expended for a second time and created a previously unpredictable drain on costs and staff. Nurse informaticist's role. As a trusted advisor to the nurse executive, the NI serves as a translator of technology capabilities, options, and alternatives to the nurse executive. Nurse executive look to the NI to align technologies and systems under consideration with the organizational objectives. Nurse executives and NI involved in technology decision-making need to leverage two specific IT expertise when they evaluate, select, and implement clinical information systems. Two important healthcare information technology processes include process mapping and workflow design. Process mapping delineates the actual steps of clinical practice as they occur during patient care, while workflow design spans the mechanical arrangement of informations, forms, and triggers to document nursing practice. The success of every HIT implementation hinges on having a clear understanding of process mapping and workflow design, as well as the ability to chart these activities in a format understandable by computers. Vendor resident engineer lack the site-specific and nursing practice-specific knowledge required to add the context to the live experience to the workflow creation process. Delegating these two foundational activities to non-nurses resembles the potential disaster. From a nursing perspective, leaving this critical foundational work to engineers and technologists who lack the hands-on experience of delivering patient care at the bedside is pure folly. Only the nurse executive or an NI working in concert with the nurse executive can design and implement overarching nursing workflows that reflect the organization's nursing process. Even in healthcare organization where this key task can be delegated to an NI, it remains the responsibility of the nurse executive that this foundational work be managed and overseen. The criticality of these two elements and their foundational importance make a working knowledge of process mapping and workflow design knowledge essential to nurse executives' evaluation, selection of clinical information systems. To summarize, to productively contribute and ultimately drive technology decisions, nurse executives need to constantly updating and advancing their hospital information technology knowledge. Nurse executives need to seriously commit to a lifelong learning, especially as it pertains to technology. Building and maintaining a deep technology competency, nurse executive will ensure that the voice of the patient is heard. Establishing nursing informatics in public policy. Public policy is the action taken by the government to address a particular public issue. It is vital that the nursing informatics community understand and acquire skills to navigate the public policy process and influencing public healthcare policy to improve healthcare delivery and quality patient care. For example, the passage of the HITECH Act. This is a public policy that throughout various efforts made it recognize and facilitate the adoption of health information technology. The Health Information Technology for Economic and Clinical Health Act, enacted as part of the American Recovery and Reinvestment Act of 2019 to promote the adaptation and meaningful use of health information technology, encourage healthcare providers to adopt electronic health record, and improve privacy and security protections for healthcare data. Since the passage of the HITECH Act, hospital and providers' implementation and use of electronic health record technology have dramatically increased. In addition, since the passage of the HITECH Act, 4 in 5 NPs in the United States are enrolled with a regional extension center and are live with an EHR. Operating on the top of their license, they offer treatment, patient education, and care coordination. Health policy refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. Health policy is a course of action that influences healthcare decisions. Public healthcare policy is that piece of health policy that deals with the organization, financing, and delivery of healthcare services. This includes training of the health professionals, overseeing the safety of drugs and medical devices, administering public programs, and regulating private health insurance. Understanding and exploring ways to navigate various aspects for impact in order to influence changes in healthcare delivery, partly through the use of technology, is an essential skill set for nurse informaticists. Legislative initiatives create opportunities for nurses to help shape policies that will drive the implementation of technology to support a cost-effective, accessible, patient-centered, and continuity of care model to improve health outcomes in our country, and increasingly important role of nurses in the creation and execution of public health policy cannot be overlooked. If the right people and organizations have engaged, the nurse informaticist recommended best practices are sponsored by a legislator and introduced in a bill. The process of public policy has a number of stages which interact in a dynamic fashion: identification, information gathering, decision-making, implementation, evaluation, termination, and renewal. Identification. Decision needs to be made on what, whether, and how to proceed. This will involve discussions about the issue, the information needed, the key actors to be consulted, and the policy options that may be available. Information gathering. This will involve reviews of the available evidence and discussions with key stakeholders and opinion formers. It will also include some initial analysis of the issue in question, of the options for actions, and of the merits of alternative courses of action. Consideration and decision making. When making a decision on the policy measures to be adopted, policymakers will assess the likely effectiveness of the options available, including the do-nothing option, the financial costs and benefits of taking action, and the political implications of taking action. Implementation. Depending on the case in question, further guidance or rules may need to be developed, and decisions need to be made regarding responsibilities for implementing the policy measure in question. Evaluation. This involves reviewing the effectiveness, the dependability, the cost, the intended and unintended consequences, and other relevant features of the policy measure in question. Termination or renewal. Termination may be explicitly built into the policy measure. The policy measure may lose relevance or may not be implemented. It is frequently the case that terminated policy measures reappear in another form, such as in another piece of legislative or led by another agency. Collaboration at the public healthcare policy level impacts the future nursing and care delivery while setting expectations for standards of care that nurses are responsible for advancing at the most salient level. Avenues for influencing policy. Nurse informaticists should understand the roles of and consider in participating in other policy development efforts such as advisory committees, policy institutes, profession organizations, technical expert panels, nursing informatic policy advocates. Increasing nursing informaticists' awareness of values, avenue for engagement, and understanding of how to get involved in the public policy process will help ensure that the nursing voice is heard. Building the skills, competencies, and confidence to engage is a part of the critical path to influence public policy. If the right people and the organizations have been engaged, the nursing informaticists recommend best practice to ensure quality of care. Advisory committees. Under advisory committees includes National Committee on Vital and Health Statistics, Health Information Technology Policy Committee, and the Health Information Technology Standards Committee. These three committees operate under the rules established by the Federal Advisory Committee Act. The FACA defines advisory committee as any committee, board, commission, council, conferences, panel, task force, or other similar group that dispenses advice or recommendations to the President of the United States and exclude bodies that also exercise operational functions. Policy institutes. Policy institutes, often termed think tank by journalists, is an organization that performs research and advocacy concerning topics such as social policy, political strategy, economics, military, technology, and culture. There are numerous institutes that conduct research and analysis, develop white papers and policy positions, and provide recommendations specifically on healthcare-related topics. But a prominent voice in healthcare thought leadership is the IOM. Profession organizations. Another important avenue for influencing health information technology and informatics policy is engagement with professional associations. Previously mentioned in this chapter are the American Nurses Association and the American Association of College of Nursing. Both actively engage in healthcare policy issues and deliberations. Also initially a subsidiary of the ANA and now a nonprofit corporation, the American Academy of Nursing serves the public and the nursing profession by advancing health policy and practice through the generation, synthesis, and dissemination of nursing knowledge. Another professional organization involved in health IT and NI policy deliberations and active contributor to policy comments is the Alliance of Nursing Informatics. The ANI, in coordination with the American Medical Informatics Association and the Healthcare Information and Management System Society, is a collaboration that represents multiple nursing informatics organizations and responds as one voice to federal health policy initiates by sharing nursing informatics perspective for shaping health policy. Another professional organization involved in emerging health technology is the American Telemedic Association, which bring together diverse groups including nursing associations for the advancement of telemedicine in healthcare delivery. Technical Experts Panel. Another avenue for influencing policy or technical experts panel is a group of stakeholders and experts who provide technical input in areas that an organization may be in need of for a broader perspective on a topic. Specific tools and meetings may be employed to select and engage the panel, assign tasks, and elicit sharing and further development of knowledge. NI policy advocates. In addition to the organizations listed above, knowledgeable policy nursing informaticists work in a variety of settings where policy issues are addressed, such as academia, vendor, consulting, and advisory firms, and within government agencies that drive public policy. Another aspect to a key strategy of influencing public policy is strengthening relationships and informing these nursing stakeholders groups about the issues, challenges, needs, and gaps. That is why increasing nursing informaticists' awareness of various avenues for engagement and understanding of how to get involved in the public policy process will help ensure the nursing voice is heard, building the skills, competencies, and confidence to engage is a part of the critical path to influence public policy. If the right people and organizations have been engaged, the nursing informaticist recommends best practices to ensure quality of care. Skills and competencies nursing informaticists need to effectively communicate with policymakers and influencers. Nursing informatics is a specialty that integrates nursing science with multiple information and analytical sciences to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. A nurse informaticist provides information about new workflows, guides new technology and process implementation, and assesses data quality, giving care teams the best chance of optimal care delivery. The informatics nurse is advocating not only on behalf of the patients, but also on behalf of all nurses and caregivers, as well as non-anticipated technological capabilities. Informatic nurse must be strategic, leader, effective communicators, and the must engage stakeholders across multiple spectrums to ensure patient nursing technological needs are understood and met. According to Suzanne Begany, Director of Government Affairs at the American Association of the Colleges of Nursing, in order to effectively shape public policy, nurses need to realize that it takes significant financial investment to compete on the national level. In addition to money, nurses must act as an impetus for message, orchestrate support, and prepare our leaders for political stage. Nursing informaticists must be able to convey their concerns about data and its availability for reporting and dissemination in terms that are easily understood within the context of the recipient's own constitutional paragon. In other words, nursing informaticists must engage key stakeholders at the intersection of the stakeholders' ability and willingness to influence change. Advocating for nurse informatics is a complex responsibility that requires in-depth knowledge of both clinical processes and clinical system. Nursing informatics shaping the future of healthcare. Future of nurses leading change, advancing health. Future of Nursing Report. The Future of Nursing Report is not only about nursing, but the future of healthcare in the United States. The report outlines nursing as a key factor to successfully achieving improved outcomes, optimal wellness, and overall population health management. Because of the breadth and depth of nursing engagement in all aspects of healthcare, nurses are the key position to influence healthcare reform and multidimensional needs across all care settings. Technology informatics guiding education reform provided testimony to the future of nursing. About the important role of the healthcare informatics in creating a vision for nursing. This is an opportunity to integrate informatics within nursing education, practice, and research so nurses are armed with necessary tools to address 21st century clinical practice in an effective, efficient, and safe manner while also holding the highest standards of evidence-based practice. Health Information Technology and Patient Safety. The IOM Health Information Technology and Patient Safety Report summarizes existing knowledge of the effects of health IT on patient safety and made recommendations to maximize and promote safety of health IT assisted care. Findings included health IT can improve patient safety even though the gaps in potential risk of health IT are not fully understood. Health IT needs to be viewed as part of a larger socio-technical system, and all stakeholders need to work together for coordinated efforts to identify and understand patient safety risks associated with health IT. Nursing informaticists are also in prime position to participate in research and development of standards and criteria for safe design, implementation, and use of health IT. Best care at lower cost. The path to continuous learning healthcare in America. Best care at lower cost defines the foundational characteristic of a healthcare system that is efficient, delivers increased value, and is continuously innovating and improving in its ability to deliver high value to patients. The report outlines several recommendations to include the need for digital infrastructures that supports the capacity to capture clinical, delivery process, and financial data for better care, system improvement, and creating new knowledge. And the need to improve data utility by streamlining and revising research regulations to improve care, promote the capture of clinical data, and generate knowledge. Applying these new strategies can support the transition of a continuously learning health system, one that aligns science and informatics, patient-clinician partnerships, incentives, and a culture of continuous improvement to produce the best care at lower cost. In summary, these IOM report recommendations and executions of recommendations provide for many opportunities for nursing informatics to influence future policy and shape the healthcare landscape. Collaboratively, efforts among several nursing-related organizations are underway to unify the voice and efforts. NI roles continue to evolve, expand, and emerge and are critical to engage in the necessary transformation activities and bridge the new care delivery models into clinical practice and the right technology solutions. Nursing informatics increasingly have the opportunity to influence and shape public policy. All nurses have a role to unlock the barrier doors that exist today for the necessary to change to achieve the one voice, one vision of healthcare transformation. In summary, the formation of good public health policy relies on quality and biased data, as well as the expertise of those who provide care within healthcare environment. Nurse informaticists must recognize the importance of engaging in the public policy process and advocating for advancement in technology and processes that will promote improved patient care, better health, and lower health care costs. We must strategically collaborate and plan to have a one voice. We must take leadership seats at the decision-making table. We must not give away our advocacy voice.